They were on the brink of death. Then, amazing medical breakthroughs. Linda's daughter was in a coma and dying.
Every organ system but two in her body had failed.
She had tears of blood coming from her eyes. The feet went black.
Found out what medical miracle allowed her to walk again. Amy lost her vocal cords and her voice to cancer until an experimental surgery.
I will never say never again.
Billy was on chemotherapy when a doctor told him,
"We've got a new drug."
and now, cancer-free. That's what's coming up right now. Thank you so much for joining us today. And today you're going to meet some people who say that they've been given a second chance at life, all because of some amazing medical breakthroughs. Now, my first guest says her teen daughter almost died, and it all started from a simple little bruise on her finger. Take a look at this.
My daughter, Shaylin, was 15 years old when she became ill, and she was in the 9th grade. And she was a dancer, a gymnast, and a cheerleader. And I picked her up one Friday afternoon, and she said, "Mom, I'm cold." We went home and we took a nap. We had dance camp that night, and when we woke up later, she had a fever of 103.7. We drove her down to dance camp, and they excused her from dance. The next day she was feeling better, so she actually went to dance camp, and she danced for 10 hours. And by Wednesday morning, she was yellow, very weak and shaky and very pale. And her arm was swollen. It looked like it was broken. Well, we just put her in the car to take her to the doctor. She looked over at me and she said, "Mom, I feel like I'm going to die." I looked at her and I knew she was right. And I reached over to grab her finger to get capillary refill, and there wasn't any. It was really interesting when we went in the hospital. They told us, "We know she's in toxic shock. We do not know why she's in toxic shock." It wasn't until later that we realized that they deduced it was from the fall. When she fell cheerleading, she bruised the joint in her left index finger and strep abscessed from that bruise, streptococcus A. Her blood pressure really dropped. Her blood pressure was so low that she flatlined. They did say she came back fairly well, but we are having a hard time keeping her stable. Blood clots that start bursting everywhere. Her legs were filled with them. She was yellow and swollen, and she actually had tears of blood. The big concern is that you are bleeding to death. As a result of them shunting all of the blood to her heart and brain to keep her alive, the feet died and they went black. The doctor came in to tell us that they did not expect Shaylin to make it through that day. And the doctor was really cute. He came in and he said, "We have a research medicine. Give her maybe 6–7% chance to live with multiple possible complications." And they wanted my consent to use it.
Please welcome Linda to the show. I'll say this. I met Linda a couple weeks back. We were at an event together in Florida, and I met Shaylin. And I can't imagine. I have 4 children of my own. Your child comes home from just doing a typical event. They do it all the time. My kid comes in all the time with bruises. I don't check every bruise on his body or their bodies. Your child comes home one day, and you knew about the fall that day, right? Did she tell you about it?
I knew, but I had forgotten.
Forgot it, man. But she said, "Mom, I fell today. Oh, it kind of hurt my finger, but I'm okay," kind of thing.
Well, she had fallen actually on a Monday, and we didn't have symptoms until Friday.
Now, initially, what did you think? Flu? Cold?
Yeah, we thought she had the flu. In fact, she had brothers and sisters that had been running out of state, and they had cold flu-like symptoms. So we thought she just had the flu. It was typical flu symptoms.
When you walked in that hospital and the doctors looked you in the face and said, "Your daughter has strep throughout her body and is in toxic, right? Septic."
Yes.
And I want to let you know something here. She may not make it. Whoa, right?
Right.
I mean, what was your first reaction to that?
Well, the way it all happened, I believe, you know, now looking back, I think I must have been in shock or something, because at first you don't realize how bad it is. They had to do tests, and they have to run tests, and they have to run things, so they kind of bring it on, you know, it's kind of gradual.
But when your daughter walked into that hospital, she was kind of lucid and appeared, okay, looked sick. But a day later,
she was completely out of it.
looked like she was on her deathbed.
She was.
Tubes coming out of everywhere.
She was by that day, later that day, by that afternoon.
Explain it in the process of what happens with this when this, it's a bug, it's a bacteria, correct?
It's a bacterial infection.
Bacterial infection. So explain what happens.
Have any bacterial infection that can go invasive. Invasive just means it goes all throughout your body. And it happens in a short period of time, and it goes into septic shock from there.
Which means that every one of your organs is poisoned and your body's trying to fight it but doesn't have anything left to fight it with because it's now exhausted your immune system. And so basically the infection starts to take over.
Right.
And in Shaylin's case, I mean, there was a point in time where they tried to, I guess, what was it, trying to stop and slow down the infection, they had to lower her blood pressure, or her blood pressure was lowering anyway?
Her blood pressure is lowering anyway. The infection does that. What it does is it raises the vessels in your blood, and your vessels are porous anyway, so it swells it, and the infection makes it enlarge. So you only have a trickle of blood going through, so you don't have anything, no pressure to pump the body system. So what they have to do is close that back down.
And in her case, they started bursting.
They started bursting because they were clamping them down, all the little blood vessels. They were closing them down really tight and then putting in a lot of fluid. So then they start bursting.
And they start bursting, we're talking like she starts bleeding tears.
She literally had tears of blood from her eyes.
You watch this go on, and at one point in time, did not the doctors come to you and say, Linda, I'm telling you, I don't know what else we can do here.
Yes.
Look, I don't know. It's a long shot, okay? But there's this medication. If we could get her on this medication, is that how they say it?
We knew, we had been prepared, and he was basically telling us she's going to die. She will not make it through the day. She will not live through the day. And we have a research medicine. It's never been tried on pediatric patients, and we want to try it on your daughter.
But while this is going on, because they had to give her so much medication to try to compensate for the blood pressure issues, it started restricting some of the blood flow to extremities.
It did. When I talked about the vessels clamping back down on her, clamping down on her vessels and then putting the blood fluid in and the blood vessels bursting, they clamped down on all the small vessels. So she wasn't getting blood flow to the tissues in her legs and bone and in her feet. And eventually the feet went black and the tissue died.
And you're watching this, so now you're thinking,
Yes.
my God, my daughter's dying, and they have to amputate her feet. Let me take a little break. We'll talk a little bit more when we come back. We'll be back right after this.
She looked at me with this look and she said, I'm dying. And I knew
Do you remember saying that?
she was right.
I do, actually.
And what did you think that moment? Did you actually think you were?
I actually did. I was in horrible pain, and I just knew I was going to die.
And I said, would I be the first person on the planet to take this drug post-surgery? He said, yeah. I said, well, would you, pretend I'm your wife, would you recommend this to me? And he put his head down and thought a minute, and he said, no.
Are you a teen who survived a freak accident and you want to share your story? If so, call us at 1-800-MONTEL-2. That's 1-800-MONTEL-2.
So was this an intravenous? They started by drip? Is it one injection? Is it a pill? What did they do?
They told me it was a drip, an IV, that they would have to drip for 96 hours.
What was it, the day 3, day 4 after they started this medication that she started to turn the other direction?
She kind of started turning the other direction. It was through the weekend. We had a really rough weekend, and then probably by the beginning of the next week and mid to the next week, we were feeling pretty secure about things.
Pretty secure to bring her out of the coma, out of the induced coma?
They did. They started very slowly.
And then, is that when they decided they had to do the operation?
No, actually, it was a little while after that. Shaylin was actually awake. She wasn't real alert because of all the medication, but fairly alert. And I had actually just run home that morning for just a couple of hours. I'd been living at the hospital, and I went home to, just do some home family things real quick for a couple hours. And a doctor came in and he said, everything that's black's going to be gone. And her nurse said, oh my gosh, she's not 2, she's 15. She can hear what you're saying. And she looked down at her feet and she said, guess I won't wear flip-flops anymore.
They did the surgery?
They did the surgery on March 21st.
And we should say this is from a young lady who was a gymnast, a dancer, a cheerleader,
Skier,
skier. They did the surgery,
they did bilateral amputations of the feet.
and she now, though, is capable. Well, look, please
Let-
welcome Lynn's daughter, Shaylin, to the show. Good to see you. How are you doing?
Good.
Good. Let's talk about this for a second. Well, let's go to the end. What are you doing these days?
These days,
Yeah.
I'm on dance company,
Mm-hmm. And
and I'm hopefully trying out for cheer.
you tried out last time, but it had nothing to do with your physical ability that we couldn't make the team last time, right?
Yeah.
You missed a lot of school. It's okay. Grades
Yeah.
were right, but we'll make it this next time.
Yeah.
I'm pretty positive. So, I mean, she bounces back, and you've lost almost, what, 2/4 of each foot?
About the middle of my arch up.
All right, watch out. Let's back up and talk about when this went down, when this happened, right? When you, that Friday, when you said to your mom, I really don't feel good, what were you thinking was wrong with you?
I had no idea. I just thought it was really cold out because I was shivering. I was cold. I was wearing a hoodie. And it was February, but it was still warm out. So, you know, my mom just told me that I probably had the flu, and I was like, yeah, that sounds right.
Except the first day. That first day, because I will never forget that. Driving her to the hospital, we knew she was sick, but I was thinking maybe she had hepatitis or something, and she kind of was rocking back and forth from the pain, because when your blood vessels start to change and everything's closing down on her body, it hurts. And so she was rocking back and forth, and finally she looked over at me and she touched my arm while I was driving, and she said, Mom. And it wasn't so much what she said, it was a feeling. She looked at me with this look, and she said, I'm dying. And I knew
Do you remember saying that?
she was right.
I do, actually.
And what did you think that moment? Did you actually think you were?
I actually did. I was in horrible pain, and I just knew I was going to die.
You came out of that coma and the doctors came to you and said, Miss Dancer, I'm going to make it so you never dance again. I'm taking half your feet. And your mom told me your answer, and I heard this 3 weeks ago, and I was like, are you kidding me? But what did you think? You, okay, well, at least I'm here?
Pretty much.
Yeah.
I was just grateful that I could be alive.
You know, had this doctor not, I guess his name was like Dr. Cheatham?
Dr. Cheatham.
Had he not suggested that aggressive, and it's really,
It is aggressive.
it's aggressive, and I'll tell you, this is not experimental because it has been used before on adults, correct?
Correct.
But still, it was an experimental procedure to use it on you. And had he not done that, again, you wouldn't be here today. But now we know that it can work on children, so the number of other kids that you may have just saved could be untold just by having them doing that to you. I'm really, seriously. I know you wanted to say something to him, so we had the doctor put together a videotape for you, and then the tape messed up, so I said, I get the doctor here. Please welcome Dr. Wick Cheatham to the show. I would say this must have been a tough one for you to kind of try to suggest to a mother to try, right?
It was something that I had never used before myself, so I didn't know anything besides what I had read.
You know, I mean, this show's about medical breakthroughs and about the fact that there are breakthroughs happening right now, folks. I'm telling you, as much as we like to beat up and complain about the medical industry and the pharmaceutical corporations in this country, they are working really hard. And it's because of a drug like this that we have this young lady still sitting here. But come on, Doc, I mean, you, like you just said, you read the literature.
Yeah.
But somebody had to make the decision.
She made the decision for us. I'd say she was on, and I've told them this, and I think that I heard the mother's explanation of her illness, and I think it was very good. I'm glad. I'm always surprised when the parents can remember anything when they're in that situation. But the fact that we had used every blood pressure medication, without exaggeration, to keep her blood pressure up, which is, I think, part of the reason she had some of her complications, to keep the blood to her heart and her brain, she actually had to lose some of her extremities. And so we were at a point, as she mentioned, every organ system but two in her body had failed, her heart and her brain. And so we had no choice. We had a choice to make it yes or no. We decided that with the mother's help, that this is something worth trying. And it had not been used in kids, and it was something that in the adult literature is met with some bit of speculation. But we had no choice we felt. We said we've used everything we can. There's this new drug out there, as you mentioned. Tons of research went into this, and we said,
you know what?
let's give it a shot.
I got to applaud them. I mean, you know, we spent a lot of time on the show talking about the controversial things that happen within the drug community, and I'm going to tell you something. When they step to the plate and they create things like that, it takes brave doctors like yourself to say, let's give it a shot. So, thanks. Amina. All right, so we'll break. We come back. A young woman who is stricken with cancer and told that she will never speak again. Let's see her when we come back. We'll be back right after this.
Amy Hancock lost her vocal cords to cancer at the age of 21. Now, Amy must decide, is she willing to risk pain and suffering on an untested surgery to find out if she can have her own voice once again?
Well, my next guest was a college student majoring in communication when she lost her ability to communicate, her voice. The Discovery Health Channel featured her story. I want you to take a look at this.
Amy Hancock lost her vocal cords to cancer at the age of 21. After 5 years of using an electrolarynx device, Amy's doctor has offered her a chance to regain a more normal voice with an experimental surgery that's never been tried before in the United States. He plans to transplant skin from her own arm into her throat to create a new voice. Now, Amy must decide. Is she willing to risk pain and suffering on an untested surgery to find out if she can have her own voice once again?
I think right now my goal in life is to live to Friday, and then I'll deal with the rest of it after that.
For Amy, a normal life used to be making plans for a career in radio when she was a communications major in college.
I've been in radio in the past. I was a DJ for a few years, and I enjoyed that. So I was thinking that for the future. I just pretty much played music. I read the weather.
Everybody listened to her. I mean, she was known around our area as Amy Lynn on the radio, and very pretty voice, very pretty.
On this talented newcomer, recently we talked to John, and he discussed his honest, heartfelt feelings toward all of us, his adoring fans.
Well, this is your last chance to back out.
I'm not backing out. I have that idea in my mind. We're going through with this.
The surgery is over, but there are several critical steps before Amy will know if she can talk with her own voice once again.
Just let it happen, but...
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
In the middle there, did you hear that really cool voice? Okay, you're letting yourself voice at that point. That's the voice we're looking for, right? One more time. Big breath. I'm going for a long walk. Ready? Go. Hit it.
I'm going for a long walk.
That's it. Just take a breath. Without all that air pressure.
Please welcome Amy to the show. Step of trips. Now, I'll tell you, I mean, thinking back, you're going to college, you are a DJ. It just seems like it's so ironic that that would be the cancer that you would get.
I think sometimes, you know, that just happens.
Sure.
I mean, there's no rhyme or reason to it.
None. Okay, so when you were first diagnosed with cancer, did the doctors, at that point in time, did they think they were going to have to take out your vocal cords?
Whenever I went in, I went to the doctor, and he wanted to do a biopsy. I didn't even know what that was. We didn't even discuss cancer.
Mm-hmm.
And then when he called and told me I had cancer, I think that was probably the most shocking moment of my life, because I wasn't anywhere near prepared for that.
Mm-hmm.
And so I had radiation, and then that didn't work. And so then whenever I went in to have my laryngectomy, they didn't know if they were going to have to take both vocal cords or if they could just take the one. So I found out after I woke up that they
And sometimes when they do go in, looking at it, the biopsy kind of made it appear as if it was only affecting one side, right?
Well, it was at that time. That was 6 months. I started radiation in June, and then I had my laryngectomy in December. So it was a 6-month time cap.
Mm-hmm. So surgery's over. I'm sure devastation, and depression, the loss, those things take place.
For a little bit, I think, but you have to move on. I mean,
But you, for the first, 6 weeks, 8 weeks, did not even want to try to use that device, right?
not even a little bit. No, it's really hard to admit. that I think for me, it was really hard for me to admit that I needed help doing something that I've been doing for 21 years. And then, and I don't want to say anything bad about people that use electrolarynx because they're a wonderful device. But I didn't want the rest of my life to be like that. And I never really thought that it was going to be like that, so.
So now all of a sudden, so for the first 3 weeks, you're writing down notes. Then you get the electrolarynx and you use that. And you use that for how many years?
I used it for 5.5 years.
5.5 years, so you got used to it.
Yeah, I did.
Okay, so then all of a sudden, a doctor comes up, or did you read about this? How did you know?
My doctor, he's amazing. He was teaching a class to his students. He's a professor also, and he was telling them about this surgery that they had done in Germany. They'd never done in the United States. And he said that he realized that that surgery would work for me. So his nurse called me, and I went into the office, and that day I did all my pre-op testing.
Wait a minute. They call you and say they did this surgery in Germany. They don't do it anywhere else. Matter of fact, it's never been done here in the United States, but yeah, I'm willing to give it a shot. You know, what we're going to do is we're going to slice your arm open, take some skin from your arm, and slice another part. I'm going to take your nose apart, take a little cartilage out of there. I'm going to take a little cartilage out of somebody else. We'll sit in the lab, make some things, stick it in your throat, and let's see if it's work.
Well, I think, I mean, my doctor's so great, and he was really confident about it, and I thought, like, I think I'm a very safe living person. I don't speed, I wear my seatbelt, and I just don't take many chances, and I did not want to look back 20 years and say, well, what would have happened if I would have done that?
Absolutely.
I just think that would be torturous, and the worst thing that was going to happen was I was going to have some scars, but I have tons of scars anyway, so.
What difference does it make?
Yeah.
Let me take a little break. We'll be back right after this. Well, we spoke to Amy's doctor, Dr. Randall Paniello, who explained to us exactly how he was able to give her her voice back. Take a look at this.
This technique involved using skin from the arm, which was formed into a sort of pseudo voice box. And it got inserted into her neck, and to make the tissue survive in the new location, it involves what we call a microvascular free tissue transfer. And that means that the skin won't live in the new location unless you give it a blood supply. You have to hook up an artery and a vein like you would for other transplanted tissues. And that's microsurgery and time-consuming, but it's also fairly routine for reconstruction of head and neck cancer patients, so it's something that we have some familiarity with. But using that technique in this particular way was new, and it had not been done in the United States before. So when I read about this German idea, it sounded interesting, and I kept it in the back of my mind when a suitable patient came along, and it turned out that Amy was that patient. She is somebody who was extremely motivated to get her voice back and who had failed the traditional and customary means of doing that.
Let's talk about, the tape kind of shows it, but what about those first words when they came out?
I mean, I was prepared for it because I just always thought that it was going to work. I wasn't worried about that, but then when it happened, I don't even think that there are any words to describe that feeling. It was amazing.
Now when you hear yourself now compared to the other voice, I mean, there's some similar qualities in it, which is very funny because they made something that you just sound like a hoarse version of yourself.
Right. Well, a lot of people say that I sound like I did whenever I was starting radiation. Like I have the same voice kind of because I was hoarse then, so I just have a hole in my neck now.
Yeah, that's cool. Well, now, are you still thinking about getting back into communication? Because, you know, there are several personalities on the radio now that have voices that are similar to yours.
Right. I will never say never again, ever.
Never say never again, without a doubt. Absolutely. All right, I'll take a little break. When we come back, we're going to do the story of a man whose life was saved by a medical breakthrough. And I'll tell you something, if this had not happened, he wouldn't be here today. But the good thing about having him here today is the fact that medical breakthroughs have saved him, and he works every day to hope that medical breakthroughs save all of us. You'll know what I'm talking about when I come back. We'll be back right after this.
They did Whipple on me.
Did they? Where was that? They took
Whipple's not good. They split you wide open, take everything out, take parts out, put it all back, and hope it works.
Are you the parent of a teen who survived a freak accident and you want to share your story? If so, call us at 1-800-MONTEL-2. That's 1-800-MONTEL-2.
Every day on our show, we face serious issues with honesty. When I was diagnosed with MS, I wasn't honest to you, my family, or even myself. This book changed all that.
Read Climbing Higher, the inspiring true story by Montel Williams, now available in paperback.
Well, my next guest says that after serving as a congressman for the state of Louisiana and as the House chairman of the Energy Commerce Commission, he never imagined that his next job would be fighting for his life. Please welcome a good friend of ours here at the show and a good friend of mine, Mr. Billy Tozan. Welcome to the show.
What's everybody?
Thank you so much for being here. And I will say, I'm going to say this right now before we even get started. Last week, is it not? Was it last week you went to go see some doctors about something?
I sure did.
Last week, and you saw your doctors and your test came back?
All clear.
Okay, I don't tell you what that means. Cancer-free. So now we'll talk about what that means. That was last week. Last week. And I mean, really, man, we were pulling for it. We were all doing that here. Let's back up, sir, and talk about how this whole thing even began. When was the first time? You had suffered from ulcers, right? Or you
Actually, I didn't know I had an ulcer.
Didn't even know you had an ulcer.
You know, like Peter Jennings just woke up one morning and all of a sudden the doctor said, you have lung cancer, and all of a sudden his life changed.
Correct.
I'm going along having a great career in Congress, loving my life. I'm being interviewed to take Jack Valenti's job as head of the Motion Picture Association.
Oh,
how fun that would be.
No kidding.
Everything coming up roses. I come to New York for a meeting December 16th, just about a year ago, and I had a spontaneous bleed event. Lost half my blood in a hotel here in New York. Didn't think I'd survive that. Found out it was an ulcer, and a month later it was diagnosed as cancer of the duodenum, which is the
right at the bottom of the stomach, right?
Yeah, right next to the pancreas.
Right.
Very dangerous spot.
Okay, so that now they took out. They went in and operated.
Oh yeah, they did a Whipple on me.
Did they? Where was that? They took
Whipple's
out the
not good. They split you wide open, take everything out, take parts out, put it all back, and hope it works.
Okay. And they did that.
They did the Whipple.
And they were like, okay, Bush, I think we got it. And then, no.
No. I went to MD Anderson in Texas. Sloan Kettering here in New York, MD Anderson in Texas, probably the two best places on earth to go if you've got cancer. So I went there to see about chemotherapy and radiation, to follow up on the surgery. Doctors there did a CAT scan again, which they always do.
Right.
And I said, bad news. You got a lymph node in there with a tumor still on it. It never came out in the surgery. And worse than that, we don't have a protocol. We can't go back in. We can't undo your surgery. We don't have any known protocol to deal with this kind of cancer where it is.
And at this point in time, you were not part of the medical industry in a sense. But
no, I was still a member of Congress.
But I mean, but would you? My question was, oh, come on! Now they got ways to stick a hole. Just cut a little hole right here, go
pull
through the side, pull it out that way. I mean, I'd be coming up with suggestions. They couldn't do that at all.
Nah. It was literally against the spine, in a position where they'd had to undo all the surgery, which they couldn't do.
Right.
So they said, you know, we've got a new drug. Came out about 1.5 years ago, called Avastin.
And you said?
I said, well, what's the deal with this new drug? They said, well, we don't know. But we think if we use it on you, it might get this cancer. Now the bad thing about it is it could undo all your surgery.
Oh.
Because it cuts off the blood supply to tumors. It also cuts off the blood supply to healing tissue. So you got a choice here.
Either take this and we get, let's say if you don't take this, the tumor's going to kill you.
Yeah.
But if you take this, you might kill the tumor, but we might kill you.
Yeah.
And then wait, did you not ask this question? We're going to take a break. You asked the doctor a question. Did you not say to him, look, would you give this to your wife? Did you not ask him that?
Yeah, well, a little later. Yeah, he wanted me to take it during the radiation phase. And I said, would I be the first person on the planet to take this drug post-surgery? He said, yeah. I said, well, would you, pretend I'm your wife. Would you recommend this to me? And he put his head down and thought a minute. He said, no. And I said, wait a minute, I forgot to ask you something. Do you like your wife?
Let me take a break. We'll be back right after this. For free studio audience tickets, call us at 212-989-8101 or visit our website at montelshow.com.
Have you had reconstructive surgery after a freak accident and you want to talk about it? If so, call us at 1-800-MONTEL-2. That's 1-800-MONTEL-2.
You know, I asked Linda the same question about her child, though. I mean, here comes a doctor, and you know me. I spend a lot of time in hospitals. I see doctors, I'm always questioning.
Yeah.
You would tell me one thing, boy, I'm telling you, I'm going to the internet, I'm going to go get me 5 Dixie, I'm coming back in the doctor's office going, wait, they said right there. You know, he said, okay, but the guy says to you, this is so experimental, sir. I'm telling you, we're hoping. And I know in the back of his mind, I got a congressman right here. I bet not kill this dude, but you know what I mean?
Yeah.
I mean, that's what they're thinking.
Yeah, I think they think that for every patient.
Everybody,
I mean,
sure.
they love every patient that comes to them equally. But this was not experimental. This had gone through 14 years of trials and tests, which is, I don't know if you know this. I think we had a meeting, you and I, the other day, we talked about it, but every new medication that's invented and brought to market in America takes about 14 years of clinical trial and testing.
I'm going to make sure we get this clear. Mr. Tozan is the president of PhRMA, which is the largest, what would we call PhRMA?
It's a trade association, representing the companies that invent these medicines and market them.
And so when I said earlier about there's a man who knows where we sit now all the time, I'm happy that PhRMA has you now as their president. Because now we have a person who's not just a corporate executive, but we have a patient. We have a person who understands and gets it. I'm telling you, this man gets it. Yeah. And this is the man who is influencing all, I'd say, 30 of the top 100 companies in the world.
That's 160 now.
Right here, this guy is doing it. And well, wait, we got to finish talking about it. We're going to talk about PhRMA in a second. I want to come back to that. But, and talk about the process by which it takes to get a drug to the marketplace and actually get it into a patient like yourself. Yeah. But this drug, 14 years of tests.
14 years of tests.
They still hadn't used it yet, right?
Yeah, they were using it.
They were.
They just hadn't used it on somebody who had just been through surgery. See, I hadn't healed yet. I was still in the process of healing from the surgery.
And you had the chemo you had to go through.
I had to go through about a year of chemo, about 30 rounds of radiation, and I took chemo while I was doing the radiation. Wow. Just as an extra precaution. I finished up in January. And every cancer patient will tell you this, Montel, it takes a year out of your life. Right. And it changes your perspective on everything. I mean, you all of a sudden you realize what's important about life and what's unimportant. And you learn to, again, appreciate the people you love and your friends and guys like you who are going through things. And all of a sudden you have a new perspective, and that's sort of what I bring to this job now. But after all this year, I finally had that meeting with the CAT scan, the doctor. And he said, you know, those decisions we made together, just you and your wife and I, no federal bureaucrats, no government officials involved, just the 3 of us in